Hello and welcome to Urgent Care Management Monthly. The tables have turned today, and with me is Dr. Tim Reynolds.
Hello.
And he is going to share with us some expertise on physician staffing models and some tips you've learned over the last 20 years of staffing a clinic. So
Sure.
to start with, one of the things you do at Healthcare Express is continually analyze your staffing numbers.
Right.
Why do you do that?
It's a constantly moving target. So I'll give you an example. 2009, we had the swine flu. This is the biggest example, right? And we literally couldn't find enough warm bodies to staff. I mean, from doctors, nurse practitioners, PAs, nurses, everything. We just had, everybody all hands on deck from open to close. And when the swine flu started subsiding in 2010, our staffing model did not, because we weren't paying close attention. And by August of 2010, our profit margins were gone. And we couldn't figure out why. We went back and looked at our staffing model, and suddenly our doctors who had been seeing 5 patients an hour were now seeing 1.2 patients an hour, because we had the same number of doctors and 1/3 the patients.
Huge difference.
Huge difference. So now we're pretty adept at monthly at least, and even more often weekly, looking at numbers versus staffing.
And how, if somebody has never looked at their numbers versus staffing, how do you recommend they do that? Do they divide the number of providers they have by the number of patients?
Yeah.
Do they actually track?
So the easiest way, the most simple way, is to take your providers, take your number of patients and divide the two and say how many patients per hour is each provider seeing. It can get a little more sophisticated if you then take it on a per day basis. For instance, I can take on a Tuesday and tell you from 9 a.m. to 10 a.m. on Tuesdays, this is how many patients we average on Tuesday from 9 to 10. This is how many patients we average on Friday from 4 to 5. And so not only can I look at how many patients each provider is seeing per hour, I can predict based on history, based on recent history, how many patients, how to staff the clinic at busier, what's going to be the busy times. I can tell you in our clinics, the busiest time is from 8 a.m. to noon. In some other clinics, the busiest time is in the evening. So depending on your model and where you're at, how you staff which parts, it varies, so you have to keep looking at that. And it changes over time.
Gotcha. How do you, one of the things we do at Healthcare Express is we have physician extenders. That's not everywhere.
Correct.
But how do physician extenders, if people opt to use them, how do they fit in and help you figure out a staffing model?
Yeah. So some people choose not to use physician extenders and they only have physicians. And I think that's based a lot on state laws and also based on physician attitudes towards physician extenders. We like them and we use nurse practitioners and PAs. And what you have to do then, if you decide to use them, is obviously follow the state board. Every state medical board has guidelines as to how many physician extenders a physician can supervise, how they have to be supervised, whether or not you have to be in the building, all those kinds of things. So you have to follow the guidelines, and then you have to set up your own philosophy of what's important. So we try and we use PAs and nurse practitioners a lot, and we keep supervision of them by pretty strict guidelines that we've laid out, so that we're making sure we're watching what they're doing and helping them. Ours is almost set up kind of like what I describe like a residency. It's like there's an attending physician surrounded by some residents, and the residents are seeing the patient. The attending physician is making sure they're doing everything correctly.
And your physicians all enjoy that because it's kind of a teaching.
Yeah, the physicians get to teach. They don't have to feel like they're grinding through patients all day long. And the advocates that say, hey, we only use physicians, one of the problems with that is the physician feels like he's always on a treadmill grinding through. This gives our physicians a chance to teach a little bit, talk with patients, to spend some more time with them, because he knows if he spends time counseling a patient for 30 minutes, the whole clinic isn't backed up because he's the only guy there.
How have your patients responded to using physician extenders for urgent care?
Absolutely love them. I mean, we have the occasional patient who come in and say, I only want to see a doctor, and we have no problem with that because we have a doctor available for that. But in general, with putting my ego aside, a lot of them would rather see the PA nurse practitioner.
Gotcha. What do you think the right mixture is between?
I think the right mixture is, obviously it depends on your volume. I think you start out with a physician. When you hit a volume where the physicians can't see patients in a timely fashion, then you add a physician extender. When that gets overwhelming, I add another physician extender. So you end up with a doctor and 1, 2, 3 physician extenders. That's about the limit. And then at some point, if that increases, you need to have another doctor after that.
How important is it, do you think, the culture is to your staffing model and having the right people in there in the overall?
Yeah, I think it's absolutely critical. The interview I did with Pam talking about culture and attitude, when we hire physicians, PAs, nurse practitioners, the number one thing to me is they have to be clinically competent. They have to be able to take care of patients. Right behind that, and almost head to head with that, is they have to fit into what our model is. Example, Healthcare Express, we have a casual dress code. We wear jeans and polo shirts that say Healthcare Express in our names. We do not wear suits, ties, and a white coat. Some physicians and or nurse practitioners would not feel comfortable in that environment. Neither one's right. You just have to pick and choose who feels comfortable in the type of environment that you create versus another environment.
One of the things that you started recently, or one of your partners started, was a newsletter to keep the physicians informed. And one of the issues that came out was customer relation tips and keeping up with it. How has that newsletter helped with communications in the clinic?
I think greatly, actually. It was a great idea. I think we started it, it's been several months now. And once you get to a certain size, communication becomes the problem between your staff, between your doctors, between your physician, because a lot of times I don't usually work with the other doctors, right? Because when I'm there, they're not there. So communication becomes difficult. So this newsletter, Kevin sends out a weekly newsletter. In that weekly newsletter, we basically pick subjects that all of us agree need to be talked about. So somebody will go up to him and say, hey, it seems that we're having a lot of trouble with the lab and how that happens. Could you write a newsletter explaining to us how we should do that? And so then we'll make the weekly newsletter about that. So it's always a subject that involves all the providers and everybody kind of gets on the same page.
One of the things you said at the very beginning is your staffing model is always a moving target.
Yeah.
If you had to emphasize that, is there a specific time of the year where you want to pay more attention to it, or is it just you need to pay attention to it every week?
Well, I think you need to pay attention to it all the time. It's a moving target because at different times of the year it's changing, right? In the winter time is generally the busier season for urgent care nationwide. There may be some exceptions to that, but in general, the winter time you're going to have a lot heavier staffing model. July and August tend to be the slowest months in urgent care, and so certainly in the winter you want to pay attention. But then if you don't pay attention in the spring, you're still going to have the same staffing you had in the winter. So you always sort of have to be watching that.
What happens when, let's say, you have all these practitioners hired for the winter, and then you do hit that spring and summer slump? How do you handle that with your staffing model?
Therein lies the magic. There's no easy answer. What we try and do is we try and overload that's probably not the greatest word, but it's true. Overload our doctors, PAs, nurse practitioners with work in the winter time, and they just know, hey, you know what, we got to suck it up and do it. Because that's why you went to medical school.
Kind of like being a bear.
That's right. That's right. And in the summer times you're going to get a little lean, and sometimes people don't get all the hours they want. The nice thing that does happen though is the summer's when everybody's taking vacations and stuff. So it kind of works out because everybody gets an opportunity to take vacation. We have coverage without being short on coverage in the summertime.
Is there anything else you want to tell urgent care owners out there about staffing and setting up a staffing model?
I think the important thing is to create a staffing model whereby, the hardest part and your number one job as an entrepreneur and as a business owner is to sell your ideas. You have to be a salesman. And so the best thing you can do is come up with, as a group, and get everybody's buy-in from the beginning. The easiest way to sell something is create it with them, right? And so what we've tried really hard to do is we'll sit down with our provider once a month. We have a business meeting, and we'll sit down with all the providers and say, okay, what seems to be working, what doesn't seem to be working. And it's interesting. They, more than us, more than me, can help create the staffing model, because they'll say, when I'm working over such and such, I really feel like I'm short on Mondays and really need some help, or it feels like there's too many of us at a certain day, and they'll actually help us create the staffing model.
Awesome. Thank you very, very much.
Thank you very much. Thanks for having me.
Thanks for being part of Urgent Care Management.
You're welcome.